The Women's Self-Health Podcast is a place where women can go to find support, information, and tools they need to take control of their own health. We discuss the needs of women so you can become your own self-help guru. From how to manage your stress, eating for effective weight loss, real talk on self-image, maintaining lifelong health, and healthy aging, we cover it all. Be sure to visit womenssshh.com for more information on everything discussed in today's episode.
Hi, and welcome to another episode of the podcast. Today I have Alex Burgess from iMove Physiotherapy in Sydney joining me. Alex is working at the Miranda Clinics and also the Panania Clinic. She covers a number of different clients across the two clinics and specifically is focusing at the moment on women's health. So welcome, Alex.
Hello, Megan.
So I just want you to just talk about a little bit about your background. So how did you get into physiotherapy? I know you're from Canada, which is awesome. But how did you get into physiotherapy? When did you decide that's something you wanted to do?
So that's actually a really good question. The turning point for me was actually when I was doing my undergrad degree. So I studied my bachelor's of kinesiology at the University of Calgary. And my goal was always to work for Doctors Without Borders. So I was gearing towards med school. But throughout the course of my undergrad, I just had what I deemed my mid-degree crisis where I realized I'm not enjoying the pre-med classes, but I'm really enjoying my core kinesiology classes. And just analyzing that and taking a step back, it led me down towards physiotherapy. So I switched my plans from medicine to physio, and that's what led me to Sydney. And I'm happy to be here and happy to be with iMove.
Oh, wow, that's fantastic. So how long have you been in Sydney at the moment? You've been about, I think, a year working, and you've working with the iMove clinics, focusing on women's health there. So what, in terms of the patients that you see at the moment, what are some of the things that have been coming up for you most recently?
So the things that I've been seeing have mostly been rib pain for pregnant women, as well as some back pain too. I've been getting a lot of knees from all types of women, a couple shoulder injuries, necks, a few headaches here and there as well. So just, it's been a wide array of things.
That's great. It's good to start with a wide array of women, I suppose, and the different injuries that they have as well, to kind of, I suppose, get an overview of what mostly affects women. I know it's pretty broad in that spectrum, but can you talk a little bit about back pain? Specifically, you said you've had rib pain working with pregnant women. Have you found, in terms of lower back pain, I know a lot of people tend to say, back pain's, there's weakness in the back or their back's weak, and I find that it's not necessarily always a weakness. It can be a lack of capacity or a deficiency in coordination. So with the women that you find that are having sort of rib or back pain issues, what would you say is the main reason that you think that that's occurring?
Well, just first off with that, it would be tricky for me to word my response because of just the sample size that I've seen with those specific conditions. I don't feel it's large enough for me to use a big brush and paint everything with it.
Yeah.
So I think you touched on quite a bit of it already, where it really comes down to what's going on. So it could be the weakness, as you said, the lack of capacity. So a woman needs to move around and do the activities to get her through her daily life. And with that weakness might be causing the back or other muscles to compensate in a way for her to perform that task. So that's when things can flare up and get a little grumpy, as well as even if you're just sitting for a long period of time, a lot of people will start to get their back pain that way, whether pregnant or not.
Yeah, absolutely. We'll touch on that a fair bit as well, because I know that's a common problem with that excessive spinal flexion as well.
Yeah. So one thing we do with the sitting is we analyze the posture. We look at and see how is the curve. So good solution that we come up with for the short term to get the pain relief is providing lumbar support. So you can use the cushions to put in the small of your back, but one thing that I recommend is using a towel. So you tightly roll it up and put it in the small of your back, and it helps to support that curve, and a lot of people will find relief with that. So it all depends, though, in terms of what pattern of back pain the person has. So you can have specific back pain where coming from a traumatic injury perhaps, or back surgery, or you can have non-specific back pain where you're just not too sure where it comes from. And with that, like I said, we look for the pattern. So if you get it when you're sitting down a lot, that is often a flexion pattern. Whereas if you get it where you're standing up a lot, that's extension. So we would test those movements individually. So bending forward would be flexion, leaning backwards with your hands on your hips would be extension. And then there's two other movements where you're leaning side to side or you're rotating side to side. So we assess those and we see kind of what is flaring it up the most. And that's how we kind of determine what's the best treatment moving forward from that. So,
okay. And so for the people that you've assessed, and say it was someone with, a non-specific back pain in a standing up position through extension. So
Yes.
when you've assessed that, sort of where would you go from there in terms of recommendations for that patient?
So it depends how acutely injured they are. So with that, we would take a look at the joints specifically in the vertebrae. We might do some work on that if they're stiff. If the muscles have increased tone, or as the layman term is, you've got knots in your back or your back feels tight, we might address that. But oftentimes those two will go hand in hand a little bit, but we also want to strengthen the back. So the reason the joints are stiff or the muscles are flared up is it's not able to work within that capacity that you mentioned. So it can be, some weakness there. So once we settle the symptoms down, we want to help make things stronger. So a lot of people will think, oh, I've got back pain. It hurts. That means I'm not going to move. I'm just going to rest and let it be. That
No.
Exactly.
Yeah.
You want to do the opposite of that. So research has shown that the more you move around, the better it's going to be. So that's why it's good to have what you're doing and get them moving, get them active.
Yeah, absolutely. I have a lot of people come to me that will say, I was just at work sitting in my chair and then I just got up and turned and I twinged my back, or I hurt my back here or something, my back hurts. And I was just touching on what we were talking about before, that obviously if they're constantly in that position all day, they're constantly in spinal flexion. Of course, if they go into some kind of extension, that's going to possibly cause injury because those muscles are lazy or they're weak or they're just not being used. They're not used to that movement pattern. It's inefficient. So yeah, it's not surprising to me that happens.
Yeah, exactly. And the more you rest and don't move, the more it's going to stiffen up or tighten up. So the more pain you'll be in, or you'll be prolonging that period of symptoms.
Yeah, absolutely. So with clients like that as well, it's more important, like you said, to settle the symptoms down, but also to increase that capacity so that it doesn't continue to occur in the long term, I suppose.
Exactly. And that's one of the big concepts that that we really try and nail is somebody will walk in and they'll have their initial injury, but we want to address that and we want to help you in that acute phase. So when you first have the pain, but one thing that we want to do is we want to prevent that from happening again. So we want to make you stronger or better able to adapt than your original baseline. So with what I mean by baseline is before you got the injury, with the level of functioning that you were at, it wasn't able to tolerate the load or whatever you were putting the activity. So that's why injuries happen, because the body just wasn't able to adapt. So once we address that initial concern, that initial injury while you're in the clinic, we want to help you get better than your previous state before the injury so that it doesn't happen again, if that makes sense.
Yeah, absolutely. That's really important. I think in a way, it's actually really good for people in a sense. And I know a lot of people probably don't think that when they first get an injury, but especially if it's more of an acute injury, that it's a way of the body kind of giving them a signal or giving them an awareness of, hey, this is an area that you've neglected for a fair bit of time now. And if you don't fix it now, it's going to be a more chronic thing, not an acute thing. So if you can definitely, which is great, which the iMove guys do and yourself, is increase that capacity so that they are stronger when they come out of the injury. It's obviously going to improve their movement efficiency in all areas as well.
Yeah, exactly.
So we just go back and talk a little bit about pregnant women in terms of their capacity. Would you say in terms of coordination and movement patterns, that one of the issues for them when they get initial back pain that happens with pregnancy is obviously they've got this different distribution of load that happens as they increase through the pregnancy. And their movement patterns are obviously going to change around that. And that's kind of the cause of some of the back pain in the people that you've seen so far.
Yeah, I think that would definitely play a role of it, because depending on what age you're getting pregnant at, up until age X, and then you're suddenly pregnant, you've got your front load, your belly's heavy. So your body's not used to that. So it's going to take some time to adjust. So that's when you're right, the capacity changes as well as what you need to be moving and that sort of thing, let alone just the hormonal changes that are going on within the pregnancy and the body. Yeah. That'll play a factor as well.
Yeah, because we know that obviously the hormonal changes are going to affect the laxicity of the muscles and that as well. So if you did have a client that was coming to you that was in the early stages of pregnancy, in terms of kind of either safeguarding their back or making sure they've still got a good capacity in their back going forward in the pregnancy, what would be your recommendation in terms of exercises they can do or things to kind of mediate those changes in a way?
That's a really good question. So with that, if it's early on in the pregnancy, it's not too bad to be doing some movements to get relief in terms of, I'm just a little hesitant to talk about this because it's not a hard and fast rule.
Yeah.
So I don't want people walking away saying like, oh, early stages of pregnancy, I can do this, I can do that. It really comes down to the individuals.
Yeah.
So and that's the thing, like it's all on a case by case basis where it depends what type of pattern you have because that dictates what kind of exercises we would be prescribing.
Obviously, and absolutely, it also comes down to what they were doing before they got pregnant and how adapted their body already is too.
Exactly, as well as if they have any other conditions. So if they have rib pain or the location of the back pain. One thing I will talk to though is later on in the pregnancy, a lot of people will try to do some 4-point yoga positions such as cat-cow. And in the later stages of your pregnancy, we kind of want to avoid these positions just because of the condition diastasis of your recti abdominis muscles. And what diastasis is, it's the separation of the tissue between your two abdominal muscles. And it happens in pregnancy regardless. Everybody will get that separation of the tissue where it's kind of just stretching on either side. You can imagine if you're wearing a hoodie with a zipper and you're pulling the zipper at either side because as the baby's growing, your belly's pushing out. So that tissue in the middle is becoming stretched. So that zipper is opening up right across the belly. That happens. But if you go into these 4-point positions and pull the baby down, stretching that opening further, that's why we kind of want to avoid the positions later on. The exception being, there's always that exception. Yeah. There's always that. The exception being when it's getting close to giving birth, if the baby's not in the correct position, your doctor will or midwife will advise you to get into these 4-point positions so that the baby has room to move around and get in the right position.
Yeah, so, obviously that's different because there's a purpose to, they're trying to get it moving for the birth as opposed to strengthening the kind of muscle tissue and surrounding areas, which is what in the class or exercise we'd be kind of focused on.
Mm-hmm.
Yeah.
So the tricky thing with that is some women want to work on their core muscles while they're pregnant and like doing a bird dog exercises. So you're in a 4-point position and you're lifting alternate legs and arms. So one, we don't want you in that 4-point position. So we would modify it where you're standing up, and if you change really any exercise, so you're standing on one foot, or if that's too difficult, where you're in staggered stance, so you've got one foot in front of the other, that turns into a bit more of a core exercise. So you could be doing bicep curls standing on one leg, and that's engaging your core. So you're working your core without being in 4-point position, which is ideal.
Perfect. Yeah, I know I have a lot of women who come to me in the gym or who can get in contact with me as well that are kind of either concerned about the state of their core muscles before they give birth or after they give birth and what's kind of safe for them to do. Yes. So I know kind of you can't make blanket recommendations, but as a kind of general rule, what would you say is sort of the things that you should kind of are safe to do during pregnancy at the later stages, and things that you should really avoid in terms of core work towards the later stages of pregnancy?
Any core work where you're lying on your back, just because of the amount of pressure it puts down. As well, if you're feeling quite heavy and quite unbalanced, then I would say towards the later stages, avoid the one-legged stance positions I just mentioned, and that's when you would modify it and still have both feet on the ground, but have one foot in front of the other. So it's just a regression of that.
And in terms of after the birth, so how long sort of, I know it's obviously different for natural birth as opposed to cesarean section birth. Mm-hmm. So let's kind of go over those two then as well. So how long would you kind of on average recommend for a woman after giving birth naturally that she should wait before doing any specific core exercise?
To be blunt with you, I feel like that question is just a little too outside my scope right now. And even just discussing that with some of my colleagues, it seems like it does really depend. Because you don't want to go to the gym and go too fast too soon, because that does compromise now your pelvic floor and what's going on there. So you could get some prolapse going on, and I know that's just a whole other discussion. So yeah, I know that's not the answer you're looking for, but
yeah, it does. It's a very individual thing. And I guess for the ladies that I've had come in, it's been more a case of assessing how they're feeling. And I mean, they'll often tell me if they're feeling weakness in the area, or they feel they don't quite have control over those muscles, that kind of connection between the brain and the muscles hasn't come back completely as well. Because obviously, in a sense, even if they had been doing training before, simply because of the other tasks that the body's had to do during the pregnancy, they have become more of an inefficient movement pattern, or same as someone who's been excessively sitting for a long period of time. They're just kind of, sitting there and haven't been worked for a while, so need to be woken up in a way again.
Exactly. So with that, it's not the traditional hit the gym as hard as I can for my core exercises that you tend to think of. So what we would introduce, and this now is answering your question, you can start right away with this, it's called an isometric hold. So you can lying on your back, or if that's not uncomfortable, after the baby's been born, or you can lie on your side and do this. The cues are, imagine you're about to be punched in the stomach. So you would engage your core in that way and then ease off. So it's just 10% of that. So you're not holding on and flexing that muscle as hard as you can. You're just doing about 10% of that. And that's just what we would do. So you would hold that. As that becomes easier, we would add in some deep diaphragmatic breathing. And then once they've mastered that component, we would do some other exercises. So we would add in a clamshell, hence why you would be lying on your side. And it's very tough to master doing all three at once, but just getting that core involved, that will help address your pelvic floor muscles as well. So that's kind of the process we use for that, and hence why you can start that process right away.
Okay, so then would you focus more on sort of getting more strength back in their pelvic floor muscles before moving on to more abdominal work once they've given birth, and getting more control of the pelvic floor area as the main area of concern?
That's a good question. I would say it would be good to address the pelvic floor, yes. And that's something that, we would want to do right away. But it's not a matter of, oh, hey, let's get our six-pack back immediately after pregnancy, because the process for that, it's quite grueling for the body.
Yeah.
So I would say give it a bit more time, because even just with the hormones in the body with that, you kind of just have to slowly work your way back into it rather than hit the ground running, because that's when you get, as I'm sure you've seen, injuries and other conditions popping up.
Yeah, I think that's an important thing to mention, because I think a lot of women don't really understand that, like, it's a big trauma for the body to go through, and that process once they've given birth of healing and going through it, as you said, it's a grueling process to try and strive for that six-pack abs or whatever they're aiming for, and to put your body through that extra trauma and stress once it's just given birth is just going to cause, like you said, increased risk of injury and with that real spike in the hormones. So, I mean, what I take it in a case-by-case basis, definitely with the ladies as well, like I said, seeing how they're feeling, but I'm sort of hesitant to get into anything until around 6 to 12 weeks after they've given birth, I'd say, closer to the 12-week mark.
Yeah, exactly. But even just, as I mentioned, that isometric hold, that one where you're imagining you're getting punched in the gut, that's helping to strengthen the muscle.
Yeah.
And that's helping your abdomen muscle. So unfortunately, as health professionals and fitness professionals, we're both working against the media expectations of, oh, I just gave birth, I've got my six-pack back in 2 days, or something just completely absurd. Like,
completely unrealistic.
Exactly. And that's what's getting published in magazines and all over the internet. And yes, people are more aware of that, but it's still an uphill battle to fight those biases. So it's okay to be who you are and take that in stride. And everybody's different. And that's kind of the theme that's been coming up in both of our answers in this discussion. So you just have to take things in stride and don't compare yourself to other people's standards. Just do what you need to do in terms of the fitness for your own body. And that's kind of the best way to go about it.
Yeah, I feel so sorry for the women, the pressures that they have after giving birth, because it's just unrealistic to come back in that time. And yeah, your body needs time to heal. And I think the best way I try and kind of counteract some of those media expectations that you said that are just completely unrealistic is to just explain to them what their body's gone through and why it needs that time to heal and the reasons why these things are happening and they're feeling a certain way. And I find that can be quite comforting to a lot of them if they understand why something's happened, the reasons for waiting and things we can do in the meantime until their body's healed enough to kind of come back stronger and fitter than they were before.
Yeah, like your body just took months creating another human and growing that another body. So you're going to need the time to recover from that. It's just, like you said, it's unrealistic expectations, but I think we're doing what we can to help with that.
Yeah, absolutely. I know it took 9 months to grow them, so it should take 9 months to get back into how you felt before, at least. That's how I kind of gauge it for them anyway.
Yeah, it's not like you took 2 weeks off your training schedule between competition. It's far from that.
Good. And it's good to kind of chat to them about that, get them involved in the kind of recovery process as well, so they feel they've got a good understanding in line with like you said, the health professionals that are working with them. I find that helps, especially with getting something like buy-in for them to understand the reasons why we're doing something and to really take their time. I think if they don't have that understanding, they're going to want to try and rush things and go for that media perspective that they've been fed as well. So I think that's really important.
Well, and that's one thing we do here is like we take into account your goals, but you'll get your hard and fast bench line markers. So for instance, if you've got an ankle injury, you've got to be able to do a single leg calf raise on a step with 10% of your body weight. So once you can do 10 of those, you're kind of in the clear, like a clear marker. So getting back into the pregnancy side of things, like depending on what you want to be back into, like, okay, we'll work towards that and we'll set the goals accordingly for what you want to accomplish.
Yeah, it's really good, I think, like you're doing, to involve them in that process as well. And I think understanding the body and giving them an understanding of their own body beyond kind of a baseline level by involving in that process can help as well, because as we've both talked about, assessing people on an individual basis, sometimes with women and with the recovery process, it might not just be a simple musculoskeletal problem. Often I find, other elements in their life, obviously having a new baby is super stressful. They're having less sleep, their nutrition might not be as good as it could be. So all of these other factors as well can obviously affect their recovery time as well.
Exactly.
Yeah.
And that's one thing, like physios are trained to pick up on those other cues. It's not just the biological side of things, because one model that a lot of us use, although it is under debate, is the biopsychosocial model. So we look at everything in life where you've got the psychological factors that you mentioned, so the stresses, but you've also got the social side of things where, hey, they just gave birth to their new parent, or their parent again. So you've got those additional factors, let alone the bio side where I've got back pain. So it's everything at play. It's not just the one thing that we can hone in on.
Yeah,
and we try to address and navigate our way through all that.
Yeah, absolutely. And I think with a lot of people too, with injuries that they have, often it's not always so that they might come to you and say, I don't know if you find this in the clinic as well, but I definitely find it with clients that come to us here at KMJ that they might say, you know, I've got hip pain or, you know, I've really had really bad shoulder pain here this week. But, you know, I'll often ask them, so what else has been going on in your life this week? Have you had, or just have a general conversation with them even and find out, you know, they might have had, you know, an assessment for uni, or they've had like 10 things on with their kids. They've been running around to meetings with people at work, really, really stressful meetings, or something going on that's causing them to hold extra tension in their shoulders. And it's actually, you know, tightness in their upper traps that's causing their shoulder pain. Or, yeah, it's not always the root cause of where they actually come to you with a complaint.
Yeah, exactly. That's exactly it. And it's just a matter of building that rapport with the person, but listening to what they have to say, just as you do at KMJ, but as all of us do here and a lot of other health practitioners. It's listening to the person's story and then treating appropriately, not just like, oh, let me just do a couple tests and this is what hurts, so okay, I'm going to do that. You will get some effect, but we like to treat the person as a whole. So
yeah, I think that's what's so great about yourself and all the other guys and iMove, the clinic itself, is that we work in the same way, and that's addressing the whole person, looking at the whole elements of their life and their body, not just what's right in front of you, and very forward-moving progressive treatment, which is great. I think it's a really good way to treat people and not have them as just coming for your appointment and go away, here, do this. You've got no involvement in the process and understanding why and what needs to happen.
Yeah, exactly. Because at the end of the day, a lot of the treatment we provide, especially at iMove, it's very exercise-based, and we're not ashamed about that. That's something we're quite proud of. And every physio has got their bag of tricks in terms of what they do in clinic and out of clinic, which is what makes why a patient has to kind of find the right fit for them. But with that being said, a lot of the onus will come down to the patient's participation in whatever is going on for them. So the participation in treating their condition. So with exercise, I can do whatever I need to in the clinic. Like, I do hands-on skills for sure. But if the patient doesn't do their exercises at home, then it doesn't matter whatever I do in here. They're not going to be achieving those goals that they have set.
Yeah, I know. I say that to ladies all the time too, that if they're not finding results, and they'll kind of come to me and say, like, you know, I'm coming for my one PT session a week for 30 minutes and like it's not changing everything. And I'll sort of say, well, you know, I see you for half an hour a week. There's a lot of other hours in the week that we need to have a look at. So then that's time for us to kind of sit down and break down what else they're doing throughout the week, how they're getting movement in each day on the days that I don't see them, and what their nutrition looks like, what their sleep looks like, what other stresses they have in their life on the times when I'm not seeing them, to kind of either just make them aware of it or then make a plan for the time when I don't see them, so it can make the time when I do see them more effective. Because like you said, you can do everything you can in the clinic or in the gym, but if they're not doing kind of their part outside, it's not going to move them forward.
Yeah, and that can definitely be a deterrent for people, because if you're in pain or if you want to achieve your goal, you're looking for that quick fix solution. But until somebody comes up with that, and if they do, they'll be charging a lot more for any sort of consult, the onus does fall into the individual, and people aren't always comfortable with that. But that being said, a lot of people will rise to the challenge because their health is important to them, and let alone not only that, but you don't like being in pain. Nobody likes being in pain.
Absolutely.
It's uncomfortable. You're limited what you can do. So they will do their exercises to help get rid of that. But that's the thing. It really comes down to, hey, I've got this condition. I've got the tools of what I need to do, so I'm going to sort it out. And it's quite cool when somebody comes in and you can see the progress they've been making, because you know they've been putting in the hours. And it comes down to, like, hey, you did it. That being said, and you and I talked about this briefly in person, and one of my colleagues brought it up as well, is why would I come see a physio? I can Google what exercises I need to do.
Oh,
and
no.
Yeah. So the best analogy I came up with that I was telling you about, but for the listeners, is, yeah, but you can also Google chocolate chip cookie recipes. How do you know which one's the best one for you? So that's why you've got yourself who's a trainer, as well as other professionals where we've gone through the training, we've seen the conditions, we have the experience, we know how to tailor an exercise specific to you, and let alone make sure you're performing it correctly, but doing so in a way where you're getting the results that you're after.
Yeah, absolutely. I love that analogy, by the way. It's brilliant. Brilliant.
Thank you.
Yeah, that's absolutely right. Because like you said, someone could Google, I need to do calf raises. That's how I'm going to fix my injury. But they don't know how many calf raises, what weight they should be using with the calf raises, how many times a week they should be doing the calf raises for their injury. They've just seen a general prescription for someone else somewhere that's had that injury.
Yeah. And even when you come to a physio, like, we're all human. It's a fine-tuning process in terms of getting the exercises right. So that's why we prefer to have the first couple appointments close together, because if you send somebody away and it's guaranteed they might be doing the exercises a little incorrectly, despite, showing it in the clinic or in the gym and they know what to do. Sometimes we're human. We all forget things. So they'll go home, they'll do it a little differently, or they might just stop entirely because it's too painful. So that's why it's the fine-tuning process, because they come in, oh, it was too painful, or, oh, I'm doing it a little differently and I'm not getting this result. Then we adjust, we turn the dials a little bit, get it just right, and then they're good to go for the next little bit.
So if someone someone wakes up tomorrow and they've got like a really bad shoulder pain and they're like, oh, this just won't go away. It's every day this week I've woken up with this shoulder pain, or, this is the third time this week I've woken up with a sore back. How long would you kind of recommend them kind of waiting before they'd go and see a physio? Or would you say, like, as soon as you wake up with back pain, you should see a physio?
That's a tough question, because there's a lot of things at play there. In my ideal little world, it would be nice if people came in as soon as they got that little niggle, where it's just like, ooh, I'm feeling a little off, or hey, something's not quite right, because then we can address it before it becomes a full-blown issue. And I've actually had patients with that, where, oh, hey, like, I'm not quite up to snuff, but I did do something. Would you mind checking it out? And that's one thing a lot of people aren't aware of. Physios are trained to help prevent injuries. So just with our knowledge of how things are moving, like, if we can spot that weakness or that deficiency, we can help address it before, oh my God, my back, it's an 8 out of 10 pain scale, or it's on all the time, or I couldn't even walk this morning and I can't lift my shoulder up above my head or past my shoulder height. So sooner rather than later would be my answer for that in a roundabout way.
Yeah, I definitely agree with you on that one. I mean, that's what attracted me to working with iMove as a clinic in itself in the beginning, was the fact that they're so big, and all of you guys and all of the other people that you work with are really have a big focus on that preventative side of things, so that I know if I see a client in, they come to the class and I can see they might be struggling with something, or they've complained once or twice within the week of getting back pain or hip pain, or commonly shoulder pain as well, that I can say, look, go to the iMove guys, get it checked out, get some things that we can do either before class, after class, or things that I can modify in the class for you, so that A, it doesn't develop into a bigger problem, and B, we can get maybe some surrounding structures that are a little bit weak strengthened up that you didn't know were weak before you went and saw them.
Yeah. And even just a specific example of that, we're highly involved in the community. Like, KMJ Fitness is one of our partners, and we're very happy for that. But even just CrossFit and F45, the CrossFit Open is going on right now. The F45 8-week challenge, we're about, halfway through that roughly. So we're getting a lot of those athletes coming through. But before those challenges started, we were in the gyms. We were really promoting, come in, get your movements checked. So you'll be doing a lot of these exercises. Let's just screen you, see how you're going. So you're getting people who, they don't have pain right now, but hey, let's just double check. And they're able to go forth and do the technique without developing an injury. So we were able to address quite a few of those, which is good.
Yeah, prevention through education, I think, is what you guys do really well. And what I try and focus on doing as well, which is why we've had, like you mentioned, you've got those athletes in to see you beforehand, and we've had both yourself and Adrian and Hayden from the Miranda Clinic as well coming in and talking to the ladies here at KMJ and explaining a number of different injuries, exercises that they can do to prevent shoulder pain from occurring, to work on their mobility, to work on all of these areas that can help them become better functionally and move better. And I think giving that education to them and letting them understand their own health and take control of their own health is really, really important. And it gives them better buy-in to the exercises as well. They do them, they enjoy them, and it definitely keeps them injury-free for sure.
Well, and that's interesting that you mentioned giving people kind of the power and control over their own health. That's one of our core values at iMove. So we have a few, but one of them is empower. So we like to not only empower each other, but empower our patients and our community. So that's, giving your health back into the control of yourself.
Absolutely. I think that's one of, the core values that we share between both of our facilities. And it's really important I kind of feel that it's our duty in a way to pass this information on and educate them, because they have a right to know about their own health as well.
Mm-hmm.
So just give us a chat. What are you working on with iMove at the moment? I know you guys just had a really awesome planning session in Bali to start off the year, which is so cool. So cool. I'm jealous.
I know, right? Such a tough life. Heading to Bali at the start of the year with the crew. Yeah. So with that, I mentioned we've got the two other partners going on, F45 Challenge and CrossFit Open. So we're really, really heavily involved with CrossFit Open right now. You and I are working on the podcast for KMJ, which I'm so excited for you. It sounds like it's going really well, and I'm happy to be on it right now.
Thank you.
Kind of like an Inception thing going. But one of the projects I'm working on personally is Outrun Cancer's corporate treadmill marathon. It's a mouthful, but essentially what it is, and it's geared towards corporates, but it's also geared towards run clubs. Luca from Outrun Cancer has created this event, and it's the 6th year they're doing it. But you sign up with a team, and there's 6 venues, and they just opened a 7th in Barangaroo. And your team gets a treadmill, and you have 4 hours to complete a marathon with your team. So you need a minimum of 4 people on the team, but you can have upwards of 20 people or so. So everybody takes their turn running along, and the drive for that is they're raising funds to help with cancer prevention for the Cancer Council. And iMove is trying to rally to fill that last couple treadmills at the Barangaroo Fitness First. So if you're interested, we've got a couple links up on our Facebook page, iMove Physiotherapy. But even if you look up Outrun Cancer, it's getting pretty close to the event. So the event itself is on March 23rd, and it's in the afternoon from 1 to 5 roughly. But it's a good time. And for us, since not everybody's a runner, and it is a fundraising event, we're got a package going on for participants where come in, get checked out, as well as if something comes up, we're here to help you with an injury, whether it's pre or after the event. And a portion of that package is being donated towards the fundraising campaign. So we're really excited about this new partnership with Luca and Outrun Cancer. So we'll have to see where this one goes. But
that's awesome. I'll have to get the ladies involved on that one too. And then we've got a few keen runners here. I'll be keen to check that out. I'll share all the links to all of that from the iMove page onto our Facebook page, and I'll pop that in the show notes as well.
Oh, that would be wonderful. Thank you so much.
Yes, that's fantastic. Well, thank you so much, Alex. It's been excellent chatting to you today. And where can people find more information if they want to either book an appointment with iMove or just get in contact with you?
Well, I'm not going to give out my personal number. I don't think that'd be too good. But sorry. The best place to book would be online through our website. So www.imovephysio.com.au. And there you can access all 3 clinics, Roselle, Panania, and Miranda. For myself, I'm split between the Panania and Miranda clinics. And then we do have 2 other lovely ladies, Bridget and Laura, who are based out of our Roselle clinic. But I encourage you as well to check out any of the guys. They're more than happy to help. They're quite knowledgeable on women's health just across the board. So if you have any concerns, fire us up through an email. My personal email for work is alex.burgess, Burgess, at imovephysio.com.au. So if you have any questions, you can fire on. You can also message us on Facebook or comment on Facebook. We're very social media savvy, iMovePhysio, or even our Instagram. Once again, iMovePhysio. So
Thanks so much, Alex. That was awesome.
well, thank you very much for having me, Megan. It was a nice little chat.